So safety, safety, safety is always your primary concern, right? Hence the name of the section, safety and infection control, right? Patient safety. So accident, error, injury prevention is very important for us to know because patient safety goals really focus on these key things, right? So assessing the client for allergies and intervening as necessary, right? Again, if they're allergic to food, latex, environmental, um, anything of that nature, that's something very big as nurses. You always want to make sure, just a basic thing you know about all your patients is, do they have any allergies, right? And identify factors that influence accident and injury prevention. So again, whenever NCLEX or your questions that you're doing mention age, developmental stage, lifestyle, mental status, all of those play a key role, right? So we always identify deficits that may impede client safety, right? So again, we look at things. If they have any visual issues, can they see? Cataracts, glaucoma, hearing issues, do they need a hearing aid, right? Or they have Meniere's disease. Sensory perceptions, right? Have they had a stroke? Do they have issues with any traumatic brain injuries, things that can affect their occipital lobe? We look at all of those things as nurses, right? So we always identify and verify prescriptions for treatments that may contribute to any accident or prevention. So again, we look at the use of infant and child car seats. We protect the client from injury, again, falls, electrical hazards, right? We always look at impairment with seizure precautions for at-risk clients, right? And we always ensure proper identifications of clients when it comes to their care. So in which way does a nurse play a key role in error prevention? Identifying incorrect dosages or potential interactions of ordered medications, never questioning a physician's order because the physician is ultimately responsible, notifying the Occupational Safety and Health Administration, OSHA, of workplace violation, informing the client of the patient's Bill of Rights. So definitely very important. Nurses play a key role in error prevention by identifying incorrect dosages or potential interactions of ordered medications. Again, if the doctor orders 300 milligrams of latex IV push, right, you should know definitely not to give that medication, right? So again, never questioning a physician's order because the patient is ultimately responsible. Remember that test-taking strategy, it has the word never, right? That's an absolute. So we definitely can question the physician's order, right? And that's what we need to do as nurses, right? Notifying OSHA, again, that's a chain of command. You always start, again, with your nursing supervisor, any of those issues, and then it'll go its way up. Informing the client of the patient Bill of Rights, not necessarily doing anything, and it doesn't answer my question, right? My question was, which way does a nurse play a key role in error prevention? Always make sure that when you pick an answer, it matches the question. It answers the question. So ergonomic principles are very, very important, right? So ergonomics is a scientific discipline that addresses the human being in the environment to facilitate human well-being. So this makes sure that we're able to assess the client's ability to balance, transfer, use assisted devices prior to planning care, i.e. our crutches and walkers, right? So we provide instruction and information to client about body positions that eliminate potential for repetitive stressors, and then using these ergonomic principles when providing care, even for ourselves, right? So again, bending at the knees, and especially for the client, we must know how to teach them and assess that they're using their assistive devices properly, that they're lifting properly, right? So ergonomic principles are applied for 3 reasons. 1, to prevent you from being injured. 3, to optimize your productivity. And 3, to increase your comfort at home and at play, right? You can do a job the hard way, or you can do the job the easy way, right? So that's why it's so important for us to pay attention to that. So again, we also look at the young and the old, right? Looking at that, the age, what are they able to do? What are they not able to do? That plays a vital role in ergonomic principles as well. And now we looked at other things too that fall under, of course, this big section, safety and infection control is safety, right? So again, we look at fire safety, right? Again, electrical plugs, potential hazards, right? Um, Electrical safety, right? From the potential for things catching on fire. Chemical safety, right? When it comes to biohazards, sharps, anything of that nature, right? And then, of course, radiation safety, right? Even with children, right? Them putting things into electrical sockets. So all of those key things, you want to make sure that we're assessing the environment, what's going on with our patient. So always keep in your mind whenever it's a safety issue, again, looking for fire safety issues, electrical safety issues, chemical issues, and of course, radiation issues. If the patient has an implantable uterine device or implantable device that they're getting chemo or radiation from, you want to make sure you're aware of those things as well. So it's very important to make sure you're familiar with home and fire safety, right? So again, household fires are dangerous, destructive, and all too common, right? So it's very important for houses to have what? Smoke detectors, right? And an area that people may not be aware of, but the risk for fires in the chimney, right? Dryers, space heaters in the kitchen is a big one, right? So we always want to make sure that we're teaching patients how to take care of home and fire safety. So for fire, facility response plan is always what you're going to follow, right? So remember PRC, protect the client from injury, report the fire, and contain the fire. And remember, I always remember the P for PRC, priority is my patient, protect the patient from injury, then we report the fire, then we contain the fire. So remember these key things. If there's a fire, remember race, okay? Rescue or remove the clients. Remember, they're always our priority. Activate the fire alarm system. Contain the fire by closing windows and doors and extinguishing the flames, of course, with fire extinguishers, right? And if you ever in this situation, Nurse Susie, you better tell Susie to stop, drop, and roll to extinguish that fire. Blow it out. So again, you must know how to use a fire extinguisher. Great acronym to remember and memorize is the acronym PASS. And again, on fire extinguishers, you usually see the instructions there as well, right? And please make sure, again, most facilities are regulated and they do have to have fire inspections to make sure that their fire extinguishers are up to date, right? So remember, pull, aim, squeeze, and sweep. So with poison control, the young and the old, it's very, very important, right? So the goal of therapies is always to remove poison first, right? Usually from gastric lavage or vomiting. So again, we all know, unfortunately, children like to put any and everything that they can find in their mouth, right? Especially during that toddler age where they're crawling and so on and so forth, right? So again, that's what we want to make sure if they ingest anything. Number one thing is to remove the poison first, gastric lavage or vomiting. Neutralize the poison from activated charcoal, supportive care management depending on the symptoms the patient is presenting with. So again, shock, seizure, aspiration, making sure we give the antidote, right? So again, making sure we know the antidote is very, very important. And then of course, making sure we eliminate speedily that substance from the body, right? So again, caution, do not induce vomiting if the poison contains alkaline or acidic agents, right? So such poisons such as lye, household cleaners, oven cleaners, furniture polish, metal cleaners, battery acids, or petroleum products. We never want to induce vomiting with any of those products because they can actually damage the esophagus and of course the respiratory tract when that vomiting is induced. So you always want to be cautious not to do that in those particular patients. So of course, poison control, children, of course, 8 months to 6 years are at highest risk. And to them, poison looks like candy. Very interesting, right? So you always want to make sure teaching, store and lock cabinets out of reach, right? Constant supervision is the #1 preventative measure, right? So for older adults, you want to make sure, because mixed medication with alcohol, herbs, and other medications are some of the things that they commonly do, right? So you want to make sure that they're not taking their medication in the dark, they're not sharing medications, and that they're not taking expired medications. So those are key things to remember for children versus the older adult, right? And take the poisonous substance with you to the emergency room. Again, any issues, if you can identify what was ingested, you always want to make sure you take it to the emergency room so they know exactly what to do and what was ingested. Fall prevention is very, very important, right? Again, these are things that we do incident reports on, right? So you always assess risk factors, right? So intrinsic factors, right, such as age and health, and outside factors, extrinsic factors like the environment, assisted devices, and footwear, right? Again, what's modifiable? What can I change versus non-modifiable? What's concrete and what I can't change, right? So history of falls places the patients at greatest risk for fall. Always remember that. Fell once, again, might fall twice, 3 times, 4 times, right? So again, the incidence increases the risk for falls. A client with chronic progressive multiple sclerosis is learning to use a walker. What instruction will best ensure the client's safety? Is it 1, place the walker directly in front of you and step into it as you move it forward? 2, when you move the walker, set the back legs down first, then step forward. 3, maintain a firm grip on the front bar as you step into the walker. 4, use a walker with wheels to help you move forward. So make sure you know the proper use of a walker, right? And what we use for that, what we do for that, right? So the proper use of a walker, we want to make sure that the height of the walker is adjusted to the patient. Walker should be at the hip level of the patient using it, right? The patient's arms should rest on the walker. The hand grip should exhibit 20 to 30 degrees of flexion at the elbows. The patient should wear sturdy and well-fitting shoes, and you always assist the patient with the walkers. The nurse continuously assesses the patient's stability and protects the patient from falls. The nurse walks with the patient by holding him or her at the waist as needed for balance. And when they're ambulating with walkers, the walker should be held on the hand grips for stability. We always instruct the patient to lift the walker and place it in front by leaning his or her body slightly forward. When walking with the walker, the patient's body weight should be supported by the hands when advancing the patient's weaker leg, okay? This permits partial weight bearing or non-weight bearing as prescribed, right? And the patient balances on his or her feet. And we always instruct them to lift the walker and place it in front again and continue the same pattern of walking. So make sure you can evaluate the guidelines to prevent falls, right? So we evaluate the client for history of falls, medical conditions, sensory function issues, medications that can predispose them to fall, any issues with incontinence, nocturia, and of course the use of assisted devices. So again, you want to make sure that you're familiar with the interventions to prevent falls, right? So again, make sure the patient is familiar with the environment. Make sure that they have the call light within reach. You want to make sure that they keep items close by so they're not trying to overreach for it and fall on the floor, right? Making sure that the appropriate 3 hand side rails are up, right? Handrails, right? Bed locked and always in low position. Night light for them to see. Fitted non-slip footwear, those comfy, cozy, non-skidded socks that we see every hospital patient wearing. Making sure you're doing all hourly rounding, right? And if they need, because they're confused or high fall risk, get a 1-to-1 sitter. Great interventions to remember and note for your NCLEX, and of course when you become a nurse and are practicing. These are going to save you a lot of falls. So we look at age-specific safety risk factors, right? Always paying attention to, again, infant, toddler, preschooler, school age, adolescents, adults, and older adults, right? So this is just a fall risk form. Again, they vary by institution, but again, they look at different things. Again, recent falls, 0, no falls, past 3 months, 1 to 2. So they're graded on that. Ambulation, are they continent, mental status, vision, balance. And so the fall risk assessment will tell you if the patient is going to be on a fall precaution. So we want to make sure that we're using the mnemonic frail mom and dad for assessing the geriatric client in the primary care setting. Great mnemonic to memorize, right? So F is for falls, R is for relative or caregiver strain. If there's a burnout, right, and too much pressure on that family member, we look at the activities of daily living. What do they have to do? Bathe, eat, comb their hair, cook, clean, all of those things. If they're incontinent, whether they're able to use the restroom, their current living condition and their surroundings, who do they live with, first floor, second floor, how far is the bedroom from the kitchen. We look at all of those things, right? Who's at home, who's not at home. Memory impairment, again, any issues with Alzheimer's, dementia, delirium. Ocular occlusive impairment, again, if they have any visual or auditory problems, trouble seeing, hearing, right? If they're malnourished, again, predisposing them to be very, very weak, right? Again, if they're taking any drugs, advanced directives, and of course, depression. So we want to make sure that we're using the correct body mechanics, right? Body mechanics, right? So again, plan your lift, ask for help when it's too heavy. Again, widen your base of support, bend at the knees, right? Tighten your stomach muscles, lift up with your leg muscles, keep your load close, and then of course, keep your back straight when setting it down. Very good slide and pictures to remember for you as the nurse, especially when it comes to lifting objects. So you want to make sure that if a nurse observes a nursing assistant bending over as she helps an obese client sit up, the nurse discusses her observation with the nursing assistant to reinforce the need for proper body mechanics, which response indicates that the nursing assistant understands these principles. Select all that apply. So remember, we're looking for something that is good or bad based on what the question is asking, right? So true or false. So 1, I need help. I need to keep my back straight and lift with my thigh muscles. 2, I need to keep my elbows bent and use my thigh muscles to bear the weight. 3, I should bend at the knees, keep my back straight, then pull the client up. 4, I should stand at the client's side, grasp the draw sheet, and then pull the client up. Or 5, I should ask the client to help as much as possible. One and 5, I need to keep my back straight and lift with my thighs. 5, I should ask the client to help as much as possible. So biohazards includes basic things we have to make sure. Again, sharp injuries, right? Big thing that we see in our healthcare profession and in our field. Biohazard materials, right? Getting things that are contaminated with blood, feces, urine, okay? And making sure we always know the security plan, safety plan when it comes to, again, active shooters, combative patients, right? Even safety plans when it comes to natural disasters, tornadoes, hurricanes. Always important to make sure that we're aware of everything happening. Right, so again, standard precautions include hand hygiene, wearing appropriate PPE as needed, and of course making sure we know how to handle patient equipment, injection of safety practices, and of course environmental cleaning. Very pivotal and key things, right? So again, we always look at those key things for standard precautions. And usually you err with standard precautions whenever you're coming in contact with anything wet, right? So when teaching parents about fifth disease, erythema infectiosum, and its transmission, the nurse should provide which information? 1, fifth disease is transmitted by respiratory secretions. 2, fifth disease has an unknown transmission mode. 3, fifth disease is transmitted by respiratory secretions, stool, and urine. Or 4, fifth disease is transmitted by stool. So again, it's very important for you to know certain precautions, right? So we always remember ADC, right? Airborne, droplet, and contact, right? So fifth disease, aka paravirus B19, is erythema infectiosum, also known as slap cheek disease. It's a viral illness characterized by mild symptoms and a blotchy rash. Once the rash appears, the patient is non-contagious and may return to school or daycare. So we want to make sure that we're familiar, of course, with signs and symptoms of infection. So infection occurs when a pathogen gets into a person. A local infection occurs in a certain body part only. A systemic infection involves the whole body. So some of the signs and symptoms of infection include, again, of a localized infection: warmth, edema, redness, drainage, itching, pain, swelling, and tenderness. Respiratory tract infections. Usually these are the symptoms that we see: cough, sore throat, congestion, sputum production, chest pain, runny nose, rales and rhonchi. GI tract infection: anorexia, vomiting, diarrhea, and nausea. GU tract infections, right? Genitoureter, urgency, burning, discharge, frequency, flank pain, pelvic pain, itching, and odor. Generalized infection: anorexia, malaise, fever, headache, shock, right? So shock could be, again, changes in our vital signs: increased blood pressure, heart rate, respirations, right? Or decreased blood pressure, increased heart rate, increased respirations, right? Depending if the body is compensating or the patient is crashing. Joint pain, weakness, and of course, muscle aches. So very important. So there are 4 ways that infections, of course, can be transmitted, right? So make sure that you know, of course, contact, right? So this is very important. This is by direct transfer of microorganisms through touch, right? So like staphylococcus, sexual intercourse, gonorrhea, HIV, chlamydia, fecal oral, which is hepatitis A, Shigella, or droplets, which is influenza, TB, right? So again, touching a surface with these contaminated organisms, right? The vehicle is the material that serves as a means of transfer of the microorganism. So again, this can be food, like we see with salmonella, or when somebody eats something that's bad, that's growing bacteria. Blood, like with HIV or hepatitis B. Water, right, is a vehicle, right? It has cholera, Shigella, right? Or instruments like our stethoscopes, vital signs machines, and other items that are used during clinical procedures, right? So again, could be anything from the scalpel to the different surgical instruments, right? So again, hepatitis B, HIV, Pseudomonas, right? And then airborne, of course, just like the word says, with the air, right? So microorganisms that can be carried by air currents that linger in our air, right? So like measles, TB, right? And then the vector, of course, is that, I remember, like vector, right, is that invertebrate animals can transmit the microorganisms, right? So like mosquitoes are a good example of vectors, right? So they can carry things like malaria, yellow fever. Fleas can carry different things, ticks, right, plague. So those are all things that you want to make sure that you're familiar with. So very important to note about the difference between community acquired infections and then, of course, healthcare acquired infections, which used to be known as nosocomial infections, right? So with the community acquired infections, if the client develops an infection outside a healthcare facility, again, like football player develops a staph infection following the improper use of clean sports equipment, like the football, or just the equipment that he's wearing underneath his jersey, if they're not disinfected properly, right? So it's outside of the healthcare setting, acquired in the community, just like the name says, right? Very clear. And then, of course, healthcare acquired, of course, like the name is telling you, is through healthcare facilities, right? So the client develops an infection while admitted to a healthcare facility. A good example, again, a client develops a UTI following urinary catheterization because it wasn't done sterilely, right? And so the microorganism is introduced into the urethra, right? So you always want to make sure you're familiar with those, okay? So again, which client is at greatest risk for developing a hospital-acquired infection? A client with a laceration to the left hand, a client who's taking prednisone, a client with an indwelling urinary catheter, a client with Crohn's disease, right? So just looking at the question, right? Hospital-acquired, who's in the hospital, right? So again, the client with the indwelling catheter is in the hospital, right? So again, you want to make sure that you're paying attention to those key things. So make sure that you're familiar with the precaution types, right? So there's standard, which is used for all clients, direct and indirect, right? Again, organisms, for example, vancomycin-resistant enterococcus, C. diff infection, excessive wound drainage, fecal incontinence. Those are very, very important. And just remember for C. diff, right? That's one of those key things you have to remember, right? The best way, of course, for us to prevent the spread of infection is to do what? Wash our hands, right? And sing happy birthday. But remember for C. diff, you know, we can't just kill C. diff with the little hospital foam, the rubbing alcohol, the hand sanitizers that we see outside of the room. C. diff can only be washed with soap and water, okay? So you really want to make sure that you know that, right? And then, of course, droplet is organisms transmitted through the droplet route include group A streptococcus bacteria, adenovirus, rhinovirus, Neisseria meningitis, pertussis, and of course influenza virus. And then make sure, of course, you're familiar with airborne precautions, right? So these organisms, of course, infectious agents that are transmitted through the what? The air, right? Route. So these include rubella virus, measles, varicella zoster, chickenpox, mycobacterium tuberculosis, right? So you want to make sure you're paying attention to those key things. In addition to that, neutropenic precautions, right? So those are used to prevent infection in clients who have neutropenia, low white blood cell count, and are immunocompromised, right? So don't forget with the other slides that I talked about, the ADC, right? The airborne, making sure you know, again, N95 mask for who? Me or the patient? For me, right? So I need to get fitted underneath the hood so they know if anything can come in, right? And of course, negative pressure room, right? Because we want to make sure that we're protecting who? The general public from getting anything lingering in the air, right? So again, the patient will wear a surgical mask and making sure you know how to don and doff your PPE. For neutropenic precautions, remember all those things that we talked about. Again, no fresh flowers, no fresh fruits, avoiding large crowds. They can't be around anybody who is sick, right? Because their body is not able to fight off any infection, right? So those are the key things that you always want to remember. Okay, very important to know, of course, just some key things. Of course, the Center for Disease Control and Prevention is responsible for the collection of surveillance data on communicable diseases, right? So very important to know, of course, which ones are reportable, again, like gonorrhea, chlamydia, right? HIV, because again, surveillance is used to plan more effective disease control and prevention programs, right? Like COVID, like we saw, right? So each state reports to the CDC. The CDC also gathers data on hospital-acquired nosocomial infections and publishes guidelines for infection prevention and control. OSHA, the Occupational Safety and Health Administration, was established to protect the health, of course, of American workers, right? OSHA establishes safety and health standards, ensures workplace compliance through inspections, working in cooperation with the CDC, and making sure we aid in prevention, right? OSHA implemented blood-borne pathogen standards to protect healthcare workers from occupational exposures and subsequent infections from things that we see, Hep B, Hep C, HIV, right? Because again, as nurses, right, we come in contact with all of those bodily fluids, blood, urine, feces, right? And so we want to make sure that, and thank goodness for OSHA for really putting those standards to protect us in place, right? And the Joint Commission on Accreditation or Healthcare Organization, known as JCO, is an organization that accredits healthcare organizations when they are in compliance with published standards, right? So JCO implement the hospital infection control requirements as a requirement for hospital accreditation. Standards are revised again to reflect any changes, and they're published annually in the Comprehensive Accreditation Manual for Healthcare Organizations, right? So this one, of course, JCO, the accreditation of a facility by JCO is required for Medicare and Medicaid participation. So making sure that they're really under compliance, right? So these are the three entities that really you should be very familiar with as nurses, right? So this really shows you the chain of infection, right? So the causative agent can be bacteria, fungi, parasite. The reservoir, again, who's harboring or holding that causative agent can be human, animals, inanimate objects, again, like a stethoscope, a dynamap, a blood pressure cuff, right? The portal of exit, right, can be through blood, the intestinal tract, respiratory tract, skin, mucous membrane. The modes of transmission, right? So how are those causative agents transmitted, right? So again, airborne, contact, vector, droplet, right? Those are important. The portal of entry, how does that causative agent leave the reservoir and get into the new susceptible host, right? Through blood, intestinal tract, mucous membrane, non-intact skin, like through a cut, respiratory tract, like breathing in the air. And then we look at who's susceptible to getting the infection, right? So again, we look at the age, right? And who's more, when we look at the extreme age groups who are more prone to get infections, right? The really young, right? The newborns, and of course the elderly, right? And we also look at their health status, right? Do they have any chronic illnesses like diabetes or cancer or HIV? Their immunity, right? If they're able to fight off an infection, right? So again, people with cancer, HIV, leukemias, low white cell counts, they're not able to mount a response. Looking at the therapies, right? Again, if a patient's on steroids, they're increased risk for infection. Chemotherapy, again, increased risk for infection. Radiation, increased risk for infection. Surgery, right? Getting cut open, right? Increased risk for infection. So these are all important things that we have to make sure that we're aware of with the chain of infection. So this gives you a great visual, right, for all of you visual learners there about the cycle of infection, right? So again, the infectious agent, the bacteria, for example, right, needs a reservoir. So it's in a host, right? So the portal of exit from the reservoir, from the person that has the infection, is through their boogie woogies, right? So of course through the nasal discharge, right? So the patient sneezes in their hands and of course goes to shake somebody else's hand, and that person unknowingly, might not even notice they have a small paper cut, there on their finger. And then of course, because they shook the person's hands with a nasal discharge, that is the portal of entry into that particular person. And of course they are now susceptible and have that organism because they're the host, and now they are having the same signs and symptoms as the person who gave it to them. So a client is placed in isolation. Client isolation techniques attempt to break the chain of infection by interfering with the agent, 2, the susceptible host, 3, transmission mode, or 4, portal of entry. So this is important to look at. A client is placed in isolation. Client isolation techniques attempt to break the chain of infection by interfering with what? Again, the transmission mode, right? We want to make sure that it's not being sent off to the other person, right? So again, those are important things, right? So when we look at if we're placing the patient on airborne, droplet, neutropenic precautions, contact precaution, is to break that transmission from the reservoir, from, again, that particular causative agent, the bacteria, fungi, virus, whatever, from being transferred to a potentially new host. So again, these are just like the infection types and the examples, right? So again, central nervous system infections that we focus on, meningitis, encephalitis. Childhood and vaccine preventable infections you need to be very comfortable with. Again, varicella, chickenpox, diphtheria, tetanus, mumps, pertussis, whooping cough, rubella, polio, myelitis, rubeola, measles, right? So those are important ones to know, right? And we talk about that, of course, when we go over pediatrics, right? GI infections, so again, staphylococcal food poisoning, botulism, right? Acute bacterial viral gastroenteritis. So again, those bacteria that can grow on food and become stale. So salmonella, gastroenteritis, viral hepatitis, C. diff, right? Hemolymphatic infections like mono, cytomegalovirus, toxoplasmosis, respiratory infections like influenza, tuberculosis, histoplasmosis, pharyngitis, scarlet fever, rheumatic fever, pneumonia, STDs, right? Again, gonorrhea, chlamydia, syphilis, genital herpes, king cord, right? So that's like herpes 1, like the the herpes simplex virus, cold sores in the mouth, AIDS, genital warts, and then urinary tract infections like cystitis and pyelonephritis, right? So all of these infections you need to make sure that you're familiar with, and then of course, what is generally affecting that area and the routes of transmission. So the stages of infection have 4 different stages. So stage 1 is that incubation period, right, where it's kind of just cooking up. The prodromal stage is always the most contagious, where it can be transferred from one person to another. The stage 3 is the invasive phase. So these have specific findings like diagnosis, signs, and symptoms. And stage 4 is the convalescent stage. So again, that's why it's so important to understand this, because usually we want to make sure that the isolation period, of course, is initiated before the prodromal stage, before they can pass it on to anybody else. So even stage 1 during the incubation period. So aseptic technique, right? So aseptic technique refers to practices that help reduce the risk of infection in patients, right? So asepsis means being free of disease-producing microorganisms. So medical asepsis clean technique is used to reduce the number of pathogens and prevent pathogens from spreading. Surgical asepsis, this is what we know as sterile, 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 right? Those sterile gloves, right? Is used to keep items free from all microbes. So sterile means the absence of all microbes, pathogens, and non-pathogens. So sterilization is the process of destroying all microbes. The number one thing you should do to prevent the spread of infection is to wash your hands, right? So antiseptics are chemical agents that are used on the skin and mucous membranes to remove or kill microorganisms, right? So that's that handy dandy alcohol everybody was fighting for during COVID and was always sold out, and people were selling for $32 for a 1 ounce bottle, right? So antiseptics should be used only on the skin and mucous membranes. Antiseptics should never be used on instruments or other items, surfaces, or reusable gloves. Disinfectants are chemicals that are used on objects such as instruments and surfaces to kill microorganisms. So a good example would be something like chlorine, right? So these disinfectants should be used only for processing instruments and other items for reuse and for housekeeping activities, right? So the disinfectants are not to be used on the skin or mucous membranes. So it's a good example. And remember, very important, why we follow up a lot of these topics with questions is so that you can reinforce the material. So again, learning the material, doing questions, learning the material, doing questions. That is another form to reinforce the material. But again, content is key. A nurse will use surgical asepsis for which procedure? Is it hand washing, nasogastric tube insertion, IV catheter insertion, or colostomy irrigation? Infection control, medical versus surgical asepsis. Again, precaution types, again, standards for all patients using universal precaution. Standard is universal precaution, everybody, right? So again, PPEs and hand washing. Transmission-based precautions have specific directions and disease process that we need to go over and consider, right, as we talked before, right? So again, direct and indirect, droplet, airborne, contact, right? So again, make sure you know the sequence for putting on, donning personal protective equipment, gown, right? So fully cover torso from neck to knees, arms to the end of wrist, and wrap around the neck. You tie in the back of the neck and the waist. Mask or respirator is second. So again, secure ties or elastic bands at middle of the head and neck. You make sure that it fits flexible band to the bridge of the nose to kind of pinch it in, and make sure that it's snug to the face and below the chin, pulling it down under the chin. And of course, the N95 respirator masks have to be fitted, so you have to know the size, right? And that has to be done. Okay. Third, of course, is goggles or face shield. So you place over the face and eyes and adjust it to make sure it fits accordingly. And then 4 is going to be the gloves, right? Extend to cover the wrist of the isolation gown. So make sure, again, donning PPE, gown, mask or respirator, goggles, face or face shield, and then of course gloves. Removing, doffing PPE, right? So again, we're going to remove the gloves first, right? So making sure that we hold the contaminated glove in one hand, peel it off, and then take with our other hand underneath, peel it off, and then of course that goes into the trash. Then of course goggles and face shield is removed, and then the gown is removed. And then of course the last thing to be removed is the mask or the respirator, especially again if you're in an airborne room. You have to leave the room, you know, after washing your hands with the mask on, right? And then the mask is taken outside, and then of course wash your hands afterwards. So again, make sure you know how to don and doff PPE. And always remember, the special N95 respirator masks are necessary to care for clients under airborne precautions. So again, remember that little phrase that we said, my chicken has TB, right? Who have tuberculosis or other airborne infection conditions, right? And disease reporting of notifiable diseases is mandated at the state level through legislation or regulation. So it is required by law. So again, infection control, your transmission-based precautions is easy as ADC that we talked about. Airborne, droplet, and contact. So again, this is very important, right? So again, the biggest thing is your retention, right? Your ability to recall, right? So use your mnemonics, right? With the My Chicken Has TB, V-Chips, right? Spider-Man, all of those key things. There's so many mnemonics out there, you know, that we have for you, that you can even look online, but we have quite a few interspersed throughout this review. And of course, just use your mnemonics, right? To make sure that you can help you recall and retain all of those key materials. So when we hear those sirens, right, the emergency preparedness, it's very, very important that we know what to do, especially in a facility when there's an emergency, right? But even outside of that, right? Everyday emergency preparedness, right? Making sure we have a charged cell phone, right? Adhesive tape, emergency phone numbers like the poison control, CDC, 911, local hospital, doctors, right? Tweezers, gauze, antiseptic ointment, gauze pads, running shoes, right? So these are just important things. Definitely a first aid kit, disposable gloves, band-aids, cold packs, flashlights, and extra batteries. All of these play an important role in making sure that we're prepared for any type of emergencies, right? So especially if you're in Florida, right? There's hurricanes, those power outages, right? Those are always going to be important to have. So there's 3 levels of disaster ranging from minor level, level 3, to major, level 1. So a level 1 disaster requires state or federal assistance due to massive levels and just the breadth of damage, right? So we could see like a level 1 disaster with Hurricane Katrina, right? When in New Orleans, right? Louisiana. Level 2 disaster requires regional efforts and mutual aid from surrounding communities. So again, could be something where maybe just a tornado, one tornado just in a particular county. Okay, so again, those regional efforts. And then level 3 disasters involves minor to average levels of damage, local emergency response personnel, and organizations that are able to contain and deal effectively with the disaster and of course its aftermath. So emergency preparedness and response, we look at these key things. Triage, which is life-threatening injuries that are collectible and are treated first. Those who are non-critical or are dying are treated last. So of course we classify them as emergent, which is life-threatening, or urgent, which is non-life-threatening, and of course non-urgent, which is, you know, doesn't pose a great risk to the person or individual. So of course this looks at the start of a triage, like for an adult, right? So they look at key things. Is that person able to walk? Yes or no? right? So it's minor, they can do secondary, right? So if they're not able to walk, do they have spontaneous breathing? Yes or no, right? No, then they reposition the airway. If there's no breathing, of course, expected, of course, then black triage tag color. So when they're tagged black, of course, it means that unfortunately the victim unlikely to survive given severely injured, level of anticipated care, or both, right? So again, palliative care and pain relief should be provided. If they have spontaneous breathing, of course, then of course it becomes immediate, right? So their red color is pretty much the victim can be helped by immediate intervention and transport to the hospital. So this requires medical attention within minutes for survival, up to 60 minutes. And this includes compromises to the patient's airway, breathing, and circulation, right? So that's the red. And then they look at respiratory rate. Is it greater than 30, less than 30, right? If it's less than 30, of course, then it's immediate red. No, then we look at perfusion, right? Again, that's when they check the pulse, capillary refill. So they're really seeing what's the odds of survival here, right? So red is always immediate, and of course they need immediate transport to a facility. So again, if they're able to, they're not able to walk, but they're able to breathe, their respirations are less than 30, they have good capillary refill, we look at their mental status, they obey command, then they could be put into the yellow category, which is delayed, right? So again, the yellow color, the victim's transport can be delayed. This includes serious and potentially life-threatening injuries, but status not expected to deteriorate significantly over several hours. And then of course, green, if the patient's able to walk, they usually get the green color, victims with relatively minor injuries, status unlikely to deteriorate over the next few days, may be able to assist in their own care, and green is often tagged and known as the walking wounded. So specific hazards with and associated with disasters that we look at is bacterial. So of course anthrax is a big one, right? So it infects mostly animals, but of course we all knew, especially in the 1980s, when people were getting anthrax through their mail, just so many different things that people can use, unfortunately, for acts of terrorism and violence. And the drug of choice, of course, for anthrax, and that was given to patients, is ciprofloxacin, Cipro. So you definitely need to make sure you're aware of that. Of course, plague is often carried on with rodents and their fleas, and they're destroyed by sunlight and dryness. And usually any type of plague is treated with streptomycin, gentamicin, doxycycline, and of course Cipro. Viral in nature, so things like smallpox, right, spread via direct contact. They cause high fever, rash, red spots on the tongue, very contagious. And of course the patient is contagious until the scabs fall off. There is a smallpox vaccine. So again, that's what you want to make sure you educate patients on, right? And then viral hemorrhagic fever, VHF, it affects the vascular system and causes hemorrhagic rash all over the body. So again, the bacterial, of course, is anthrax, and plagues, of course, those are on the bacterial side, and the viral is things like smallpox and viral hemorrhagic fever. So remember that manifestations of anthrax, how does it look in a person, right? So again, the common one that we worry about, of course, is inhalation. It's the least common, but unfortunately, it's the most dangerous and must be treated within days or that patient will die, right? So that's what was happening in the 1990s when these acts of bioterrorism, where people would put the spores in the people's mail. And of course, as soon as you rip the mail open, they wouldn't know, but the spores would be in the air and they would inhale it. And unfortunately, you know, it could kill people in a matter of days, right? So of course, first thing that we see is the fever, fatigue, shortness of breath, cough, and death within 4 to 6 days, right? So cutaneous is the most common, open wound, curable if treated within the first few weeks. So again, we see that cutaneous with the skin. So skin lesions turn into black scabs, can't be spread person to person. Gastrointestinal is very rare, and it's usually from an ingested form of the spores. It's lethal to about 50% if not treated acutely and immediately, right? So the patient will start having sore throat, swallowing problems, cramps, diarrhea, and abdominal swelling. So of course, just make sure that you remember anthrax treatment, ciprofloxacin. Overuse leads to resistant strain, so we have to make sure that again they're using it effectively and accordingly and as prescribed, and minimize any reactions only if they're proven to have the anthrax, okay, that they are positive. Okay, so vaccine, not 100% proven, limited to those with high risk of exposure. 3 injections at 2-week intervals, then 3 more injections at 6, 12, and 18 months. And then after that, they have to get a yearly booster. So a nurse assists in writing a community plan for responding to a bioterrorism threat or attack. When reviewing the plan, the director of emergency operations should have the nurse correct which intervention. Is it number 1, all personnel should wear protective clothing, including a gown, gloves, and respiratory protection. 2, clients exposed to anthrax should immediately remove contaminated clothing and place it in the hamper. 3, clients should be instructed to wash thoroughly with soap and water. 4, access to the area should be restricted. So smallpox, of course, the disease progressively worsens instead of improving over time. Again, this is viral in nature. And you see those scabs in the last picture. Again, the patient cannot spread it once those scabs have fallen off or they're crusted over. So with SARS, this is severe acute respiratory syndrome. There's a big outbreak in 2003. That's a prime example of a non-terrorist based mass casualty biological event caused by the virus SARS-CoV. So people at risk include healthcare workers who have unprotected exposure to SARS, and usually it shows up as a dry cough, shortness of breath, with or without other respiratory symptoms. The X-ray is confirmed pneumonia or acute respiratory distress syndrome is evident at day 7 to 10 along with fever and respiratory treatments. So remember, severe acute respiratory syndrome, SARS is caused by a virus. So again, it can be proven very, very lethal and deadly if not treated appropriately. And the only treatment, of course, is going to be mechanical ventilation for that patient. The client was suspected severe acute respiratory distress syndrome. SARS comes to the emergency department. Which physician order should the nurse implement first? Institute isolation precautions, begin an IV infusion of dextrose, 5% and half normal saline solution at 100 mL per hour, obtain a nasopharyngeal specimen for reverse transcription polymerase chain reaction testing, or 4, obtain a sputum specimen for enzyme immunoassay testing. Remember what our goal is whenever we have communicable diseases issues, right? So again, SARS, you can see, of course, is a respiratory illness which brings about atypical pneumonia in the infected patients. Atypical pneumonia causes the alveoli, the air sacs in the lung, to swell and collapse, reducing the blood supply to the area as well as blocking oxygen transfer, right? So again, I'm not getting that vital oxygen and nutrients to the patient, right? I'm decreasing perfusion in the patient, right? So although the cause is unknown, some scientists say it's caused by a new virus from the coronavirus family. It also has been suggested that the strain could have originated from animals, but it doesn't appear anything like anything known to human or animal viruses, right? So again, the virus enters the body through the mouth, nose, and eyes. So that's why it's so important to institute those isolation precautions. The virus goes for all the alveoli in the air sacs in the lungs, right? And then once attacked, the alveoli swells and collapses, right? So remember, our alveoli is where a gas exchange takes place, right? Resulting in the reduction of blood supply and blocking oxygen transfer, and ultimately resulting in death for the patient. So again, treatment for, remember, SARS is droplet precaution isolation. So treatment is supportive. Usually the case fatality 10% increase to more than 50% in patients that are over the age of 60, right? So very important that we pay attention to that age group that may potentially have SARS. And then of course, putting the frail elderly people at risk. So again, very important that we understand the isolation, especially in the elderly population if we suspect SARS. Biological toxins, again, mustard gas, there's no antidote. Ricin, no antidote. Sarin GB, which is aka nerve gas, their antidotes are palaxidrome chloride, 2-PAM chloride, right? So these use absorbent powder. This does not induce vomiting. Use charcoal and provide supportive measures if a patient has been exposed to the nerve gas. And then with the sarchin, it's a strong poison. Okay, so these are some of the biological toxins that can be used as bioterrorist attacks. So again, ricin is a protein toxin from the castor bean. It can be made from mash that is left after the beans are turned into castor oil and made into a powder mist or pellet that dissolves in water. Now, the biggest thing with ricin is that after it's injected, inhaled, or ingested, it gets inside the body cells and prevents the ribosomes from producing proteins. So without proteins, all cells will die, causing widespread organ damage. And of course, with that, death is inevitable. So after 3 to 5 days, a victim, again, can potentially survive. But again, looking at the severe symptoms, it can cause fever, coughing, GI problems, again, appear within the first few hours. If it's eaten, ricin causes stomach irritation, bloody diarrhea, vomiting, followed by hallucinations and seizures. A person's liver, spleen, and kidneys may just stop working, which can cause sudden death. If it's inhaled, it causes severe lung damage, including fluid in the lungs. Low blood pressure and respiratory failure may occur, which can cause death, right? So again, if it's injected, it depends on the amount and the size of the head pin that can kill the patient, right? So much more would be needed to kill someone via inhalation. Again, that rapid route. So medical treatment is for symptoms. It may involve trying to remove the poison, of course, from the body. So treatments, of course, for ricin is decontamination. From bone marrow damage, they can give Neupogen and Neulasta, okay, to promote WBC production. For internal contamination, chelating agents such as potassium iodine, Prussian blue, and DTPA to prevent the absorption. Of course, they're definitely going to need that reoxygenation to help perfuse them, so high flow oxygen via the non-rebreather mask, IV fluids, and key diuretics like mannitol, right? Which is the only diuretic that can cross the blood-brain barrier, our key osmotic diuretic, and of course, vaccines. So we look at those things. The biggest thing that we worry about with any agents of bioterrorism, biotoxins, are the lung injuries, right? Because our priorities will focus on airway, breathing, and circulation, right? So high flow oxygen sufficient to prevent hypoxemia when they're using a non-rebreather mask, CPAP, or ET tube. We want to ensure there's good tissue perfusion, but avoid volume overload for our patients. Prompt decompression for clinical evidence of pneumothorax or hemothorax for all of those patients as well, right? So again, ET tube placement, CPAP machine to make sure they're able to breathe along well at night, right? So if there's any crush injuries, the sudden release of a crushed extremity may result in reperfusion syndrome, which can lead into acute hypovolemia, renal failure, metabolic abnormalities, right? So with any crushing injuries, right? So IV fluid replacement up to the first hour and a half, a liter for that first hour. So to help prevent renal failure, they're going to be giving the patient mannitol to maintain diuresis at least 300 mLs per hour, and dialysis may be needed. To treat the acidosis, they're going to be given IV sodium bicarb until the urine pH reaches 6.5. So that's to prevent myoglobin and uric acid deposits in the kidneys. And of course, the key thing to treat hyperkalemia and the calcemia, which can result from crushing injuries, is of course, remember from our fluid and electrolytes, calcium gluconate 10%, 10 mLs, or calcium chloride 10%, 5 mLs IV over 2 minutes. Sodium bicarb, which is 1 milliequivalent per kilogram, IV push, very slow. They can also be given regular insulin, 5 to 10 units, and D50, 1 to 2 ampules IV bolus, or of course K-exalate, 20 to 50 grams with sorbitol, 20%, 100 mLs PO, okay, for the patient, just to make sure we're able to really get our potassium levels where they need to be and our calcium levels where they need to be. So again, remember, whenever you have these patients that are exposed to these bioterrorist agents like ricin, right? Again, a lot of times, again, it's a lot of comfort measures, right? The symptoms. And unfortunately, a lot of them do succumb to the issues, right? So they're going to be intubated, mechanically ventilated, their organs are failing, right? So again, it's just a pretty much systemic wide, how do I handle this situation? Because it's like you have several fires going on in the body and you're trying to institute, again, fluid replacement, electrolyte balance, preventing the kidneys from failing, right? Protecting my airway, treating acidosis. Remember, all of this is happening simultaneously. So these are important things to remember, because again, these agents pretty much attack the key systems of the body. So that's why they're used in terrorist attacks and bioterrorist agents, because again, just because of the high mortality rate, if patients aren't adequately treated, enough to really save them systemically. So remember, the emergency response plan helps determine which clients to recommend for a discharge in a disaster situation, identifies nursing roles in disaster planning, uses clinical decision making, critical thinking in emergency response plans, implements emergency response plans, participates in disaster planning activities, and of course, key drills. Those are always going to be very pertinent and important for our patients, right? Cuestiones.